This video will demonstrate football equipment removal, and we'll start off with removing traditional cheek pads. Take a flat end of an instrument, slide it in between the helmet and the cheek pad, and wiggle it around until the buttons detach. Once they've been detached, just reach through the cage and pull them out. This will make it easier for the helmet to slide off the patient's head, just in case you have to take the helmet off. To prepare the chest pads for removal or chest access, make sure that the jersey has been cut and removed. When you access the shoulder pads, you'll see two underarm straps that can be detached just by rotating the buckle so that it comes out of the slots. Make sure these straps are tucked underneath the body so they don't get caught while you're trying to remove the shoulder pads. Now down the middle of the front of the shoulder pads, you'll see shoelaces that are either tied or snugged using this little device. Either untie it or loosen the shoelaces, and that'll give you access to the chest for compression. Now when removing the helmet, the highest trained rescuer needs to stabilize the head and the neck while the helmet and shoulder pads come off. This first clip will show you how to stabilize the C-spine as the highest trained rescuer by putting your hands on the lateral side of the head. In this demonstration, the assistant is going to grab the helmet, and the highest trained rescuer is going to grab C-spine by resting their forearms on the chest and grabbing the base of the skull with their fingers. Once they've got a good grasp, they communicate with the assistant to pull the helmet off. In this next demonstration, this is with the shoulder pads. So the highest trained rescuer has to go underneath the shoulder pads to grab C-spine prior to the assistant pulling the helmet off. By communicating clearly, the therapist will tell the assistant to pull the helmet and the shoulder pads off one right after the other before retaking control of C-spine. This is another method for stabilizing C-spine while removing the helmet. In this particular demonstration, the highest trained rescuer is going to slip their hand behind the occiput and the other hand over the center of the chest with the web space of their hand just slightly under the chin. Once they've got a good hold of C-spine, they will communicate with the assistant to again slide the helmet off slowly and carefully. Now here's what it looks like when trying to move the helmet and the shoulder pads together. The highest trained rescuer is going to slip their hand underneath the shoulder pads to grab the base of the skull, and underneath the shoulder pads to grab just underneath the chin. Once they've gotten a good grip, they communicate with the assistant to pull the helmet off, and right after, slide the shoulder pads off as well. Now we see a demonstration of full equipment removal. The rescuer is going to start off by cutting along the short side and then the long side of the jersey. He'll peel away the jersey so he can have access to the chest. Once the jersey is out of the way, undo the underarm straps and tuck them underneath the arms, just so they don't get caught when you're pulling off the shoulder pads, and then loosen the laces in front of the shoulder pads. Undo the chin strap of the helmet, and in this demonstration you'll see the rescuer remove the cheek pads. With the helmets that you'll be using in this study, there's no need to remove the cheek pads. Now at this point, if it's a cardiac emergency, it'd probably be wise to start compressions before removing any of the equipment. Finish off 30 compressions first, and then at the time when you are supposed to give the 2 breaths, that will be the opportune time to remove the helmet. In this particular demonstration, we're using the lateral hold. Once the rescuer has a good hold, they will instruct the assistant to pull the helmet off, followed by the shoulder pads. The last part of this video will demonstrate exactly the same procedure but using a different hold. The rescuer is going to take the hand in the front to stabilize underneath the chin, and the hand in the back to stabilize the occiput. Once he's got a good hold, he can instruct the rescuer to pull the helmet off, again quickly followed by the shoulder pads, and then transfer C-spine to their assistant. So here are the key points of this video. First of all, know the sport equipment that you're working with. Know the ins and outs of the shoulder pads, the helmets, the cheek pads, the jerseys. In addition, also know the tools you have at your disposal. Do you have an electric screwdriver? Is it a quick release mechanism that holds the face mask to the helmet? Or do you have anvil prune cutters to cut the loop straps? Also know your assistant's training, what they're capable of doing. Do they have basic life support skills, or are they just capable of removing equipment and helping you with the role? It's also important to recognize why you want to remove all the equipment. If the person does not have a pulse, it's important just to access the chest right away and start compressions as soon as possible. Now, if the person is not breathing, but they do have a pulse, then it's important to remove the face mask first. In this case, jersey and chest access is not really necessary immediately. If for any reason you're attempting to remove the face mask, but you cannot because you don't have the tools, because you're having difficulty, because the quick release mechanism is defective, then at that point you must remove all the equipment. If your victim's airway, breathing, and circulation are just fine, and EMS has arrived, it is very important to recognize that the person should not be transported with the equipment on. It's important to remove the equipment before the person gets into the ambulance. So in that situation, it's important to initiate full equipment removal. If for whatever reason you're having trouble removing the face mask, in other words, if it's going to take you more than 30 seconds to remove the face mask, it's important to start full equipment removal. You need to be able to get through all the equipment and start airway access or chest compressions within 60 seconds. All this is accomplished and can be successful with good communication between you and your assistant and with lots of practice.